Well, good evening, everybody. As Miriam said, it's my first research day, so I'm very nervous, but hopefully we'll get through it. So, my name is Seherish. I'm a research assistant on the Faith in Mental Health project with Julian. And I'm going to tell you a little bit about what we've been doing so far and where we hope to take this research in the future. So what is Faith in Mental Health? It's a 2-year blended research and public education project. So we're really looking and having a dual focus on interfaith perspectives and policy considerations. So our interfaith perspectives is going to be looking at what kind of resources we can make to help mental health professionals learn about religious communities and faith communities and what kind of considerations they should be bringing into therapy treatments for that, but also to help faith communities learn more about mental health, where they can get mental health, what kind of things they should be looking out for in terms of what is good therapy practice as well. And our policy considerations are going to be focusing on Muslims in the UK, and we're going to be focusing on lots of different Muslim communities in the plural because there's no such thing as a Muslim community in the singular. So we're going to be looking at access of issues of access and how we can go beyond conversations of barriers and stigma and actually answer some of them. So we've identified throughout lots and lots of different research that there are lots of barriers to access, one of them being lack of religious literacy for mental health professionals. So now it's time to answer them and rather than just repeat the same research over and over again. So what have we done so far? You'll see lots of pictures on the screen. That's a selection of books and key texts that we've used to do quite a big literature review, and the topic of psychology and religion is massive. It's very interdisciplinary, so we've looked at clinical studies, we've looked at social science, we've looked at theology, and we've even looked at reports from public organisations and their own kind of individual research as well. And then you'll see a picture of a Zoom, which Lady Hill very kindly joined us for, which was very nice, of our roundtable discussion in August, where we kind of took what we had learned from the literature and asked lots of different experts. We had psychologists, psychotherapists, counsellors, religious leaders, we had academics as well, and even people working in policy, and we asked them, what should our research do? Who should it help? And what can we do to, answer some of these barriers? And below that, you'll see lots and lots of sticky notes, and if you were in the office, I'm sure you saw my table was covered and I had nowhere to work. So we then took that away and started doing some grounded theory to find out what our themes were going to be from that roundtable. And these are some of the things that came out. And these are the overarching themes. They are by no means everything that came out. There are sub-themes within that, but obviously we don't have time for that today. And the one I'm going to be focusing on today is collaboration. So collaboration is something that came up a lot during our roundtable, and what we heard more than anything was that although there are lots of different things available, it's very fragmented in terms of mental health care for Muslims. So it can be quite hard to navigate that. My first quote is from a trainee psychotherapist who's working in Derby. And he's very proactive, and he went out into his own community and went to local mosques and started talking about mental health because he found that there was a gap in knowledge there and they were not very aware of what services were available or what even mental health is. Now, that's not to say that this is a generalization of all Muslims in the UK, because there are obviously geographical and generational factors to consider when making those statements. And he talked a lot about bridging, and he really liked this idea of bridging contemporary psychological and psychology therapies and practices with religious scripture. So he gave an example of CBT in the Quran, which is cognitive behavioral therapy, and he talked a bit about when alcohol became forbidden within the Quran and how that had an element of psychoeducation within it. So we liked that, and we ran with that, and we came across this next person who's Ibn al-Qayyim al-Jawziyya, who is a student of Ibn Taymiyyah, and he is very prolific and kind of thought of as the pioneer of what we now call Islamic psychology. And I'm going to run past him because we don't have much time. And on this side, you'll see a diagram of the soul, which is taken from our friends at Cambridge Muslim College, Dr. Rothman, and his colleague Coyle in 2018. And this is an artistic rendition. It doesn't look like that in their paper, unfortunately. So you'll see that Islamic psychology has now become a field of its own. And I've used bridging as a question because within Islamic psychology, the more we read and found out was that they're really starting from a different position of what a human is. So a lot of scholars within Islamic psychology are actually advocating for a reimagination of mental health services rather than a bridging, because it comes from a different place. And very quickly, going over this one, this is from a mental health advocate who works in the charity sector who highlighted the assets of communities. And we thought that was very interesting. So if you look on this slide, you see lots of different Muslim mental health organizations. And I thought what was interesting about this quote, and also the fact that these organizations exist, is that Muslim communities have not been passive. They're not just saying, there's nothing for me here, they're actually making services, they're using their own resources. But the problem with these organizations is that they are very underfunded and usually run by volunteers, so not a lot can be done outside of the resources that they have. And that brings me to my final quote, or second to final quote, from a mosque trustee who really was talking about co-production and the importance of working with communities to answer their needs. And if I show you the next slide, these are two initiatives in the north of England that are really doing that. So they're going out into their local communities, they're asking communities, faith communities and religious leaders what their needs are and how they can be met. So these are some things that we'd like to take further, and one of our aims of Faith in Mental Health is to see how we can identify good practice like this and amplify that throughout the country so that we don't have pockets of good practice, but everyone can access what they need. And I'll leave you with a quote from our rabbi and psychotherapist friend, who we all love. And it's a very hopeful quote, and it gives me a lot of hope for the project in that things are changing and the antipathy that was there between psychology and religion is starting to dissolve, and mental health professionals are now aware that religion can be beneficial and have value. So, thank you. I'll leave you with James Gordon.